and thank you for taking the time to listen to some ideas about how we can build economic resiliency in times of pandemics. Put another way, how can we bounce back from this COVID crisis or any of the future crises headed our way? My name is Maureen Heffern Ponicki, and I teach political science at the College of DuPage. My doctoral dissertation is on cities and economic shocks. Today, I'd like to take some time to outline what we know about economic resiliency in hopes that it will help us weather this current storm. I will not only be talking about economic tools to fight this shock, but also public health tools. As may seem intuitive, but I think bears repeating, fighting the virus effectively is really at the core of building a strong economy. They are not two separate issues. In today's talk, I will be discussing the types of shocks, what is resiliency, a little bit about research, how do we do it, what do we know, and policy recommendations. So let's begin with types of shocks. What are we referring to when we say shocks? These can be either exogenous, which is external, shocks such as COVID, or they can be endogenous, which are internal shocks, such as the factors that overheated the market, precipitating the Great Recession of 2008. So there are economic shocks, such as deindustrialization, the Great Recession, the Great Depression. There are health shocks, such as COVID-19, SARS, Ebola. There are natural disasters, hurricanes, earthquakes, and there are political shocks, such as Brexit, wars, terrorism, the 9/11 attack. And lastly, there are long-term shocks, such as climate change. All of these present challenges to our economic system. COVID has presented a historic shock to the entire global community. Unemployment has reached levels not seen since the Great Depression, hovering around 25%. The difference between now and the Great Depression is that we have provided a lot of relief, at least for now, but that relief will be expiring soon, so we don't know what is coming. In the US, 1 in 4 workers filed for unemployment, and those hurt most are at the lower end of the income spectrum. As quoted in the New York Times, quote, fully 39% of former workers living in a household earning $40,000 or less lost work, compared with only 13% in those making more than $100,000, according to a Fed official. Projections are that the virus will cost the US economy $7.9 trillion over the next decade. Globally, the situation seems most dire in developing nations with little capacity to support their citizens as they weather this shock. So let's turn to this definition of resiliency. What do we mean with this word, resiliency? It refers to the idea of bouncing back to the state one was at prior to the shock. Some definitions involve not only bouncing back, but an improvement beyond bouncing back. To be resilient means that one's whole system is able to adapt to a shock. It's a systemic approach. So the question becomes, can we not only bounce back, but also improve? Can we change and build better systems of resiliency? During crises, do we risk further cementing the divides in our society, or do we see them as openings to tackle those challenges? For example, if during COVID there have been some commendable efforts at housing the homeless, many are now asking, why can't it be done during normal times? Did COVID allow us to see a way of doing things differently? Secondly, COVID reveals the ugly face of racism, as we have seen communities of color disproportionately impacted by the virus. Can we address these stubborn systems of racism as we work to bounce back from this crisis? Can we see a new way towards a truly inclusive economy and society? Will this crisis bring us paid sick leave? Could investment in a green economy drive recovery? Will this crisis provoke a serious discussion of how to drive our economies beyond the growth model? Crises have brought us change in the past. History shows us that. The Great Depression brought us Social Security. World War II brought us the GI Bill and a rising middle class. The resiliency framework has already gained significant traction in many fields as a way to prepare for climate change and disasters. Some cities already have resilience managers. Foundations, especially the Rockefeller Foundation, invested considerable money in developing the capacity to think in terms of resilience. That means thinking in terms of systemic structural change. So now let's talk a little bit about research and what it tells us. First, in the social sciences, we are without a laboratory. So how do we build knowledge? And how do we come to understand our complex political and social world? How do we learn to build economic resiliency? One of the most powerful tools in our field is what we call comparative analysis. While many challenges have very specific place and time variables, generally, we are aided by looking across time and place. Interestingly, Americans tend not to look to other countries for advice or experience. Some argue this is a result of what is called American exceptionalism. The coronavirus may have poked the biggest hole yet in that concept and may open us up to seeing across place, and that is a good thing. Across time, what do we mean by that? We mean, how did other places react, recover, and deal with shocks? For example, the Spanish flu or SARS. It took 4 months to alert the World Health Organization when SARS broke out. This time, though not a perfect example, as we have talked about a lot, it took a while to let the World Health Organization know, but it only took 4 months, so better than in the situation with SARS. When we look at Asian countries and how they have dealt with the experience of SARS, we see that policymakers, health practitioners, and the public had experience with SARS, and therefore they were more equipped to go into action, and the public was more accepting of lockdowns. Taiwan is an excellent example of a country that was impacted by SARS and therefore had the public health infrastructure, had the laws, and had a population that remembered SARS and was therefore compliant. What can we learn from that? The Spanish flu, there's been a lot of talk about that. A very recent study from MIT looked at cities' varied responses to the Spanish flu, and they found that cities that had a more aggressive response to the virus both saved lives and had economies that bounced back better than those cities that took a laissez-faire approach to the virus. That's why we look across time and place to see these lessons. So looking across place, what does that mean? We did a little of that with SARS as we looked to the Asian countries. But basically, we want to know, what are other countries or cities doing, or places? This research is happening right now, and therefore we are forming knowledge while in crisis mode. It is coming out every day. It is changing, as we have all witnessed. South Korea, Hong Kong, and Singapore were cited early as mounting an aggressive response to the virus and flattening the curve faster than others. This chart shows very early responses in comparison to other countries. Slide 7 shows what researchers call a stringency index, meaning the overall severity of a country's response to the virus and the impact on the overall deaths. So if you look at Hong Kong's response, it was high on the index, but resulting in a lower number of overall deaths. It shows the timing of those more severe containment measures, if it happened early on or if it happened later. If a country responded sooner and with more severity, the number of deaths was kept lower. If you look at Italy, they did institute more severe measures, but much later, and therefore they struggled to keep the virus contained. We look at these, and it's changing every day, but this is how we learn. And so we need to look across to other countries for these examples. Likewise, Germany, Denmark, and Taiwan. They provide examples of how the public health response is part of the economic response. Aggressive measures to flatten the curve have resulted in early opening of the economy. It is a little too early to tell if these countries that did well on the public health front will ultimately be more resilient economically over the long term, but it is certainly something to watch, and it is a possibility. But very new research does show that those countries hit harder by the pandemic suffer worse economic outcomes. Therefore, containing virus is an economic tool, and we cannot forget that. But what else do we know from research? The beautiful thing about research and knowledge is that it often pushes us to look outside the box, and it helps us see patterns that aren't always visible. For example, in urban politics, which is my field, research has continually shown that local political conditions mediate larger structural forces. What does that mean? This means that cities and localities have a lot of power. They have the power to build resilient systems at the local level. As two urban researchers, Savage and Paul Cantor, famously state, quote, "Cities need not be mere leaves in the wind," which it often feels that way. But research tells us it is not. We have power at the local level. My own research on how cities bounce back from deindustrialization reveals that when cities evidence social connectivity, meaning the business community, the government, the nonprofits, the community groups, the universities, the foundations, when they all work together, those places evidenced increased resiliency, and they bounced back from economic shock faster, just by communities coming together. It is not just in the hands of one's government, it is all of us connecting and working together, and the research supports that. Secondly, my research found that cities and towns need to be backed up by their state governments. And when that happens, alongside a collaborative culture, the bounce back is faster. When state governments actively helped cities deal with deindustrialization, they came out of that crisis faster. In other words, government matters. In summary, that research says government matters, but they can't do it alone. They need the whole community response. If we connect that to COVID, there have already been calls for cooperation. For example, the World Economic Forum's anti-COVID plan is similarly centered around connectivity. To build economic resiliency, they say government, business, and civil society need to connect up. We need conveners who help connect folks in a community. Other factors that we know a lot about is diversification of industry in your city or your town, strong stocks of human capital. Human capital is a powerful concept. It really means we need to educate our people. We need to put investment into educating these people. And when we do that, we bounce back faster. Technology, obviously, innovation is a core concept, and leadership. Leadership matters, and good leadership helps bring us out of crisis, which is why I'm going to talk next about some crisis management research. It's another field that brings some key nuggets of wisdom, of research into this question. What can we learn from crisis management to build resiliency? According to Daniel Diermeyer, who is a crisis management scholar, trust is essential. Folks need certainty. Diermeyer's trust radar consists of 4 elements. They are empathy, transparency, expertise, and commitment. And he talks about leadership, whether it be at the business level or at the government level, showing empathy for what people are going through. Being transparent in your decisions, in what you can and cannot talk about, showing and relying on expertise, and your commitment. Think how our leaders can use these to help navigate us out of this current crisis and towards resiliency. So resiliency research, in a nutshell, views our economy as one ecosystem, just as the natural world operates. In fact, it is from the field of biology that the resilience framework emerged. But now let us move briefly to talk about concrete policy recommendations. What do we do to build economic resiliency with respect to policy? One, as I've mentioned, but I will say it again, act aggressively to mitigate the spread of COVID. Public health tool is equal to an economic tool. Testing, tracing, treatment. Research from Northwestern University finds that what we call a smart containment strategy results in deeper, immediate economic pain, but the research shows less economic pain over the long term compared to a strategy that does not include containment. And that is new research that has just come out. Secondly, in terms of policy recommendations, most economists are on board that a bailout is necessary. And that's what we're seeing. Our government is bailing out both individuals and corporations. In addition, we need to put a floor under the economy in order for it to be more resilient. What does that mean? It means government needs to invest in our infrastructure, our educational infrastructure, child nutrition, health. That's the floor that makes you be more responsive to crisis. Thirdly, coordinated responses are more effective, including coordination at the global level. We have seen that a virus knows no boundaries, and therefore coordination should know no boundaries. This is not a time to pull back and not coordinate with others, including other nations. And lastly, and to me this is probably the most important, this is a time to open up the policy dialogue. How can our economy be more inclusive and thus more resilient? There is so much research showing that a more inclusive economy is a stronger economy. So would passing paid sick leave prevent sick workers from showing up at work, which ultimately decreases our resilience? These are the type of dialogues that we need to have. Lastly, let me leave you with 3 key takeaways. Economic resilience is an incredibly complicated challenge. Can't quite be put in a short 15-minute talk, but let me just give you 3 important takeaways. 1, government matters. This crisis has showed us that government matters. They are the only entity charged with protecting the whole. Who else will protect public health? They can't do it alone, though, but they are essential. They are the convener. Secondly, expertise matters. There's been some research showing in other countries, people are more open to listening to experts. We're learning now through this crisis that this expertise matters. We're all hungry for it. We need to learn from the past, from others, and from science. Lastly, coordination and cooperation aids resiliency. Economic bounce back requires intentional attempts at cooperation amongst government, business sector, universities, nonprofit, foundations, and community groups. Start local by getting all your key stakeholders together. Build a plan. You would be amazed at how many places find this challenging. In my own research, I have seen cities struggle decade after decade at coming together and building a plan. Economic resiliency, in some, requires our government to take an active role, but it also requires all of us to get involved, to collaborate, to connect and coordinate with one another. And lastly, let the research and expertise out there guide us as we maneuver through this truly difficult crisis. So I want to thank you for joining me, and together we will go forward.